COVID-19 affects different patients differently. There are those who exhibit light symptoms such as mild pneumonia, others severe symptoms such as inadequate oxygen supply to body organs, whereas others suffer critical symptoms including respiratory failure, shock, and/or multi-organ dysfunction.
The musculoskeletal system is also affected, where they get body pains, muscle pain, and also fatigue. So they're sort of tired, which cannot be explained.
Dr. Asma Awath, an international public health specialist, illustrates how oxygen inadequacy causes damage to the lungs and its connection to other body organs.
In such cases where we have critical presentation and more involvement of damage of the lungs, you find these cases also might end up having with a prolonged effect, even post-testing negative or clearing the virus, issues of either breathing, or might actually have, unfortunately, a permanent damage where because of that extensive damage of the lung tissue, you get a bit of restrictive expansion of the lungs and might forever require to have oxygen throughout their life.
It is estimated that 20 to 30% of critically ill patients are at risk of developing blood clots, which in this case may occur as a result of overreaction of the immune system, triggering a hyperactive inflammatory response, which may then trigger the clotting. Other factors may be a result of the virus damaging small blood vessels lining the lungs.
We have instances where if the heart is involved, and especially when we're looking at the issue of clots or somebody throwing a thrombus or a clot that actually goes and blocks the blood vessels. For the heart, we might actually get in these clients having symptoms that are suggestive of a heart failure because of that block or because of lack of oxygenation or lack of blood going to that area of the heart.
Clots, as they are able to travel through blood in the body, may as well get to the brain.
We have now lack of blood reaching the brain, and those areas that are affected or directly affected by that lack of oxygen or lack of blood reaching them will sort of die off, and we can have cognitive failure whereby you lose some functions that you normally do them as a normal thing. Like we've got people who have lack of smell being there for a long time.
Emergency cases may in most cases end up fatal in absence of ambulance services. At Emergency Plus Medical Services, the personnel who have severally interacted with COVID-19 patients know all too well about the traumatic experience behind the tinted windows.
There's a unique one, a very, very unique one. It was about a child, a very small child. He really had difficulties in breathing. He had come into contact with somebody, and luckily we got the patient, we saved the patient, and the patient got to the facility that we were taking to.
The pandemic, on the other hand, has seen improvement of the services offered by ambulances.
This is the chamber, it's the isolation chamber. So when you get a COVID patient, you have to put the patient inside the chamber to isolate the patient from you and reduce on the exposure. This is the ventilator for patients who are intubated. These patients who need for ICU care, you have to intubate and get them on ventilator. And also we have the monitors. We have the oxygen. For the chamber, we usually this is what we use to ventilate the patient inside the chamber, because this patient needs to breathe inside there.
At the hospital, the cost of treatment continues to be a challenge among the patients who find it difficult to pay for the services, as majority of them need to be admitted for closer observation by doctors. Patients in private hospitals are currently needed to part with over 300,000 Kenya shillings for an isolation bed, and a whooping 600,000 shillings to 1 million shillings for critical care in ICU and HDU.
If you are in critical stage, or you have moderate or severe COVID-19 infection, whereby you need to end up in HDU or ICU, this might cost a lot of money because of the need of oxygen, the need of the drug regime itself, all these things. But if you have a mild or asymptomatic, that might not be that costly. because you can be managed within your home base.
Ben Kirera, K24, Health Beat.